In this video, I walk you through the basic steps of ICD9 coding. If you have read through your coding book and textbook, there you should may be familiar with the three basic steps that you follow. The first thing you do is identify the main term in the alphabetic index. For example, you read through the medical record, the patient has chest pain, so pain is your main term. So you locate pain in the alphabetic index and then look for the subterms and identify the site, etiology, or other clinical information you might have. So chest pain, pain main term, chest subterm, which is the site. Follow any cross-reference instructions such as see also, and select your best code. The second thing you do is whatever code you find in index, verify that in a tabular and code to your highest level of specificity. So if you have your coding books, you should be familiar with different sections of your book. So the middle part is your volume 1, which is tabular. The left part is your alphabetic index, which is volume 2, and the right side is your procedure index and tabular, which is volume 3. You can follow the same steps using the coding books. Here I'll show you how to proceed using 3M. So the first thing you should do is go ahead and use Chrome or Internet Explorer to open 3m.ahima.org and then sign in using the VLab information. And after you do that, you should have this screen in front of you. Because 3M have several modules, so I've decided to choose a module that looks like your coding book. So you go ahead and click on, or at least hover over reference, and you should see ICD9 integrated codebook. So for this video, I'll show you this section. For the next video, I'll show you how to use ICD-10 For now, let's just go ahead and click here. So what you have here is the left side, which is your index, alphabetic index, the right side, which is your tabular list. So you always start with your index, so look for the main term. Let's, for example, say the patient has chest pain. So the pain is the main condition and the main term. So we type the main term here, and we get a cross-reference instruction note here that says to see painful. As you remember, see also is not mandatory, so we can safely ignore it as long as we have what we need here. So let's go ahead and put a comma and type in chest, and the system takes us to the chest with a non-essential modifier essential, then with the code 786.50. If you have additional clinical information in the record, you can go ahead and assign any other appropriate subterm. But in our case, we're just going to assign 786.50. So always verify the code in the tabular. So we click on 786.50. The system takes us to the tabular. There are no instruction notes. So our final code here is 786.50. Let's do one more case. So suppose a patient has diabetes type 2 with coma. So we go ahead and type in our main term diabetes, and the system takes us right to the main term with several non-essential modifiers here and some notes about the 5th digit subclassification with the category 250. We know that the patient has coma, so we have the subterm with here and subterm coma. So we gonna go ahead and select 250.3. In this case, this is a subcategory. The 250 is category, 250.3 is subcategory. The system takes us to the tabular. We verify our code. We look for any instruction notes. We go back to the category level and we get some excludes note instructions, and we get instructions about the fifth digit again, as we did in the index. We're just going to go ahead right here and click on the code to determine a fifth digit, and we've said that the patient had type 2, and that's the only information we have. So our final code for this case is 250.30. Go ahead and look through the textbook and try several coding exercises using 3M, and let me know if you have any question. Thank you.